Beautiful. Thank you so much, Munshi. And I'm also part of the Envision team. I just don't have my background. It also changed and haven't figured out how to change it again. So, but happy to be here with you all. I am from California, Envision, and also part of CHWA that you'll hear a little bit about later on in our webinar today. And we're a national team of individuals, passionate individuals throughout the nation. And I come from California and have been doing community health work for a little bit now, 14 years plus, and really just passionate about the work and that we all can come even today in community and learn and share strategies, and so that we can best be of support to our community in the best way possible. So again, thank you. And you are in for a treat, not only because I'm presenting, but because we're all presenting as a team. And there's a lot of wealth of information that you're all about to hear today. So again, honored to be here with you all, and thanks for the time in advance for sharing with us. And I'll turn it to Lily to introduce herself.
Good afternoon. I'm Lily Fox from South Carolina. I work for Center for Community Health Alignment, and I am a proud certified community health worker. I am I have been doing community health work for 30 plus years, and I can't think of no other rewarding profession that I would like to be part of. I also chair the National Association of Community Health Work Board of Directors. And as Sylvia said, you are in for a treat. And I'm sure we will exceed your expectations this afternoon. And I'll turn it over to Maria.
Thank you, Lily. Hi, everyone. My name is Maria Martin, and I am in Columbia, South Carolina. I am also a community health worker and have been in this work now and leading this work for 25, 26 years here primarily in South Carolina. I work for PASOS, which is a statewide organization here in South Carolina, and recently started serving in North Carolina, bridging Hispanic Latino communities with our systems of service and care, and vice versa. So very happy to be here today, and thank you for this invite. Yes, you're in for a treat. Thank you.
And so, to get us started with some objectives for today, we have few to go over with you all. And some objectives for us is to describe the core roles and skills and value for community health workers, CHW, in specific healthcare settings. Also, to identify organizational readiness factors to support successful integration. We want an integration to be successful and also for CHWs to thrive. So we'll go a little bit into that. And also explore strategies for integrating CHWs into healthcare systems and how does that look like. And also apply key practices for onboarding, supervising, and embedding CHWs into a clinical team, also with clarifying roles and understanding of supervision and their teams as well, leadership teams as well. Next slide. This webinar was brought to us. It would not be able to partake in this if it was impossible for the support of Johnson & Johnson through the catalyzing the power of CHWs to close the gaps and advance health equity project. I practiced that like 3 times, so awesome that I got it. So yeah, just wanted to give a lot of kudos and support also to Erin, who's here as part of the Envision team, who has been working really, really hard with Johnson & Johnson to bring these amazing webinars to the community. And next slide, I'll turn it to Miss Lily.
Yes, thank you, Sylvia. And I'm going to tell you a little bit about Center for Community Health Alignment. We are a very unique and proud group of people, as you can see here. Center for Community Health Alignment is one of our core organizations on the Vision team. What makes us stand out is that we take pride in being CHW led, rooted in deep real world experience. We're based out of Columbia under the University of South Carolina, honor of School of Public Health. Shout out to the Gamecocks. CHWA is who we're well known by, is all about supporting the CHW workforce through training, technical assistance, capacity building, and advocacy by CHWs for CHWs. Their mission is to, or our mission is to use evidence-based models and meaningful community engagement to co-create solutions that tackles health equalities, starting in South Carolina and now expanding across the region and beyond. So let's talk about just talk a little bit about who's in the room. So let us know who you are. We love to get a sense of who's here. Community health workers, promoters, community health representatives, or in similar title associated with CHWs, CHW ally or supervisors, work allies or supervisors, work in healthcare or clinical settings, work for a community-based organization, others that may be interested in learning and supporting CHW integration. So take a few minutes to drop in the chat who you are so we'll know who all is in the room. Next slide, please. Oh.
Maria, you're on mute.
Oh, I'm so sorry. I'm so sorry. I began really excited and thanking everyone for sharing on the chat that we have a lot of CHWs and CHW allies is what I started to notice. But in this next slide, we're going to talk about why we need to, or why consider integrating. CHWs help healthcare systems connect with patients who are often the hardest to reach. Those navigating multiple challenges who may be labeled non-compliant or frequently return to the emergency room for non-urgent needs. My parents used to be those guys till they learned better. So we definitely have seen them in our own families. One example, a CHW worked with a patient who regularly used the ER because they weren't connected to a primary care provider. By building trust, the CHW helped identify barriers and support a care plan that redirected the patient to more appropriate and long-term services. This kind of integration not only improves outcomes, it brings critical community insight back into the system and strengthens relationships where they matter the most. And it helps providers to really understand the realities of the patients that they have. And what may get in the way of their care. Next slide. Okay. So the research is clear. The evidence continues to grow and CHWs improve health outcomes and equity. Research shows that they help reduce cardiovascular risk, support cancer prevention, and improve functioning among older adults. They're also co-effective and uniquely positioned to reach communities that are often left out of care. This is the kind of impact healthcare systems need if we're serious about advancing equity. So we have some things here to share with you and improve equity and access to and utilization of care, effectiveness in reaching hard to reach vulnerable populations experiencing inequities. There we've seen cardiovascular risk reduction as well, improved function among older adults, and cancer prevention. And it's also cost effective. Next slide. Sylvia, thank you.
Yeah. So I'll take this one, and it is how to improve population health. And if you have not heard of the phrase or words population health, really what it means is focusing really on the community, on the population that you serve. Unlike how the medical system works, is just really focusing on one disease, for example, and curing that or creating medicine for that. Population health looks at the overarching, even in the world, what's happening in the world. And one of the archiving goals in healthcare is to improve population health. And we know also by research that CHWs play a vital achieving in this addressing not only the health, but also the root causes and the social construct of how health is in our communities. And here we have this infographic that shares really beautifully how health equity and the focuses are there, where we can really look into. And again, CHW's specialty is community. Why? Because they build trust and they know exactly how communities work, because one, they lived in these communities, or two, because they have very, very well experienced lived experiences, like how it is in these communities. And their deep community connection allows organizations to reach people in ways traditional systems often do not. So again, this is really important when we look at CHWs being integrated into healthcare systems and settings, because it really CHWs, community health workers, know exactly where the bridge is to be built and the gaps to create those bridges for healthcare. Next slide.
Yes,
And
let's talk about base values, community-driven, CHW-led. As our system shifts towards value-based care, the role of CHWs become even more essential. We are uniquely equipped to address social determinants of health, things traditionally clinical visits don't have time to manage. CHWs help fill critical gaps in care, especially as we face workforce shortages, by supporting coordination, referrals, and building relationships that drive better outcomes. In short, CHW strength or care teams improve equity and deliver value in ways the system can't afford to overlook. Next slide, please. Yeah. Okay, so what's the benefit for the organizations for integration? This visual developed by the National Association of Community Health Workers and Partners in Health highlights the growing body of evidence showing that CHW programs are both effective and cost-saving. For example, in Maryland, a CHW-led diabetes program resulted in 40% fewer emergency room visits and an average saving of over $2,200 per patient per year. I think that's worth saying again. For example, in Maryland, a CHW-led diabetes program resulted in 40% fewer emergency room visits and an average savings of over $2,200 per visit per patient per year. Examples like this reinforce that we know when CHWs are integrated with care teams and organization and community benefits, far outweighs the cost. Next slide, please.
Okay, so who are CHWs? We've just seen how CHWs bring measurable value to organizations, but it starts with who they are. The American Public Health Association defines CHWs as frontline public health workers who are trusted members of the communities that they serve. They act as bridges between health and social systems and between systems and the lived realities of the people that they aim to support. To understand their impact, we have to look at both the roles that they can play and the core skills that they have and that they carry. Let's explore that next. Next slide, please. What are the roles? So according to the C3 project, CHWs fulfill a wide range of roles that respond directly to community needs and system gaps. These include core coordination, outreach, advocacy, and cultural mediation. Just to name it. They also provide health education, coaching, and social support, building capacity, conduct assessments, and even participate in research and evaluation efforts. These roles aren't fixed. They flex depending on the setting of the population and the strengths of the CHW. That's part of what makes this workforce so powerful. And on the slide, you can see the list of the roles that CHWs can have. Next slide, and I turn it over to Sylvia.
Perfect. Thank you, Maria. So for these next sections now, we'll shift a little bit into the core sections of the CHW Healthcare Integration Toolkit to launch coming up really soon in August of this year. And each section outlines key strategies to support CHW integration into healthcare. And
I'm sorry for interrupting. I think we need the next slide that goes into building the foundation. Thank you.
No, I'm sorry. I didn't go over the skill sets. I'm looking at another screen. So if we can go back to that one. Yes, perfect.
Oh, sorry about that. Okay.
No, thank you, Maria. My apologies. So we'll go over the skills that CHWs have. And more than anything, it's not what they do, but how they do it. So if you take anything away from today, or it's specifically this slide, again, it's not how CHWs do what they do, but it's how they do it. And as mentioned before, they build trust in these communities, unlike how other individuals in the healthcare profession do. The CHWs really get that across. And we'll explore a little bit of that and how that plays into their skill set. So we have a few here, and it's based off of findings from the C3 project. So if you Google that, you'll find even more information that these are, again, vital skills that CHW bring into, again, a healthcare system and settings, and also when they go into the communities. And we have such as community skills, communication skills, interpersonal relationship building skills, service coordination and navigation skills, education and facilitation skills, advocacy skills, building individual and community capacity, which is huge that they're able to do that, not only, again, for the community, but as an individual. As individuals, they can build and support individuals build that. Individual and community assessments that we'll look a little bit more into evaluation and things like that later on in the webinar. Outreach skills, professional skills and conduct, evaluation and research skills, and also knowledge-based as well. And again, you can look more for these skill sets in the C3 project by Googling, do a simple Google search as well. And now we'll go into the next slide. Of building the foundation. So we'll start here, and Maria will lead us into the sections that we will go a little bit more further into, and that you will all be able to see more. So this is more of an introduction of what you will all be able to see in the toolkit that will be launched again in August for CHW Healthcare Integration for CHWs. And I'll turn it to you, Maria.
Thank you. Next slide, please. So one of the things that we want to explore before diving into the CHW integration, it's important for us to pause and reflect. Is your organization truly ready? This slide lists a few key questions to help surface where you are in the process. Do you have a leadership buy-in? Do your teams understand the CHW role? Are supervision and support structures in place? In designing the CHW programs toolkit created by CHWs, you're going to be able to find a short set of guiding questions designed to prompt internal reflection and identify areas where additional alignment may be needed. It's not a formal assessment, but it's helpful in starting as a starting point and for conversation and also planning. Next slide. Okay. While we've focused on assessing organizational readiness, it's just one part of laying a strong foundation. The CHW Integration Toolkit will also include additional strategies that help organizations get grounded before implementation. These include identifying internal champions, aligning CHW roles to health priorities, understanding community needs, and building a strategic partnership. Together, these steps create the root system that helps CHW programs grow and not just launch. And before we move on, take a moment to reflect. Next slide, please. It starts below the surface. So it's understanding the things that I just mentioned, and they're on this slide. And as we close this section, take a moment to reflect on the questions. You can jot it down or simply keep it in mind as you continue throughout the session. And also thinking about what does your team need to be ready for CHW integration? What needs to shift in your organization to truly support CHWs from day one? And this, folks, is also very important to planning and for continued sustainability of your organization's support to the CHWs and integration into the team and for continued sustainability of not just understanding how CHWs fit, but how to also justify their continued existence within your organization. Okay, next slide, and I pass it over to Lily.
Thank you. Thank you, Maria. In our next section, we're going to talk about designing CHW roles that work. In this session, it is always about how to define, support, strengthening the CHW role so it's effective, respected, and aligned with your program goals. The next slide, that's Sylvia.
Awesome. Thank you, Miss Lily. And here we have a beautiful graph to just really bring it home for us that when we're talking about CHWs and really, again, not what they do, but really how they do it, look at this as a bridge of CHWs being able to do that. And how they do it is at the heart of it all, really. It's the CHW at the center. You have the social determinants of health on the left, the clinical issues, you know, the whole population health, popular education. It's really bringing it home that CHWs, regardless of their certification, regardless of even their experience, they come to a community, they come to a workplace, wherever they're positioned in an environment, they really bring their heart and they really bring that popular education where it's like, I'm learning as much as you are learning from me, mentality. And it's really important here to revisit a lot of the core of what CHWs bring with their essential qualities and skills. And again, really reminding us that they are the bridge between the community and hospitals and the effectiveness that they have is that deep understanding, again, of the social determinants of health. And why is this important? Just briefly on a side note, because the social factors that we as humans go through, 80% of them determine our health. Only 20% of what's going on in our health is determined really medically, and 80% is determined socially. And again, CHWs, community health workers who are in the community, really know exactly how these social determinants of health work. That's their specialty, and they bring that, again, that knowledge and wisdom into a healthcare setting where then they can also bridge. And it's a two-way bridge where individuals can go to a healthcare setting and be taken care of, and then also then go back to their communities and live a healthy, striving life, not only for themselves, but for their families. So this is really, really important to bring, again, to our awareness. Next slide, please. So then we ask, how do we then create a supportive and inclusive environment for CHWs to thrive in a healthcare setting? And it's really, again, going back to leadership and understanding the role of CHWs and having those continuous conversations of why CHWs are really vital and critical into healthcare system. And again, because they're the bridge, they know, they have this awareness, and to ensure that the team members also that CHWs get to interact with and in their integration really understand their role. Sometimes there's confusion between social work and community health work. Then again, as leadership, how do we then have those conversations so that if there's any type of confusion that is expressed in a healthcare setting, involving the teams and how the integration is working for wherever setting healthcare wise a CHW is placed, and also allowing for this to be a process, and unique CHW role should be respected and maintained along the way. So a lot of education and awareness continuously is very important when we're talking about integrating CHWs into a healthcare setting. And we'll go into the next slide. And we have strong roots and steady growth for the toolkit that offers guidance on choosing CHW integration, also models. So we will go into the toolkit, I should say, will go into models of integration so that there can be a really well understanding of scope of practice and accountability for the integration of CHWs. And I think, again, together, us being able to do this together in the teams, in the healthcare teams, is really a great strategy for us to look forward and ensure that CHWs aren't just placed, but positioned in these settings to thrive as well. Because again, we see that that's the bridge, that they can really do a lot of things that unfortunately, the healthcare professionals don't have time to do so. And I always say time is the medicine. When CHWs are placed into a healthcare setting, their medicine to be able to give community members that are in a healthcare setting is time. Sorry, time is the medicine. They have the time to sit down with patients and the individuals that are involved in a healthcare setting. For whatever reason, they have that time to take care of and to really listen and to build those gaps with the bridge for social determinants of health. And we'll go into the next slide. And so something to sit with is and really ponder and meditate on, if you will, is, are we honoring the unique skills and strengths of CHWs, bring or fitting them into existing boxes? When, if already you have integrated CHWs into a healthcare setting or you're planning to, this is a really good question to really sit on and meditate, whether we using, right? We say that word too. Are we using CHWs? And really, this is the invitation to, instead of using, honoring their unique skills that they bring into a healthcare setting. And again, creating those environments for them to thrive, and ripple into communities, into even future generations to come as well. And next slide.
Okay. Okay, making it last. Building for long-term impact. We have gathered so many skills and strengths and experienced so many relationships along the way to get us from to get us to the point of being called community health workers. So how do we make it last? Next, we are moving into section 3, building a sustainable program. And that's the key word these days and times is sustainable. So sustainability doesn't just mean securing funding. It's about creating the system, support, the infrastructure that follows, that allows CHWs to stay, grow, and lead within your organization. Next slide, please.
Thank you, Lily. Yes, so strong supervision keeps CHWs motivated and connected. Early mentorship helps them adjust to workplace norms, and regular check-ins build trust and communication. Supervision should reflect the nature of the CHW work. It's not a 9-to-5 desk job. And just like CHW's supervisors also need training to lead well. Intensive mentoring is very important. Next slide. Oh, sorry. I guess this one is, yes, supportive motivation, regular check-ins to promote communication. It's not just for, I think, the supervisor. In our experience, not only does the supervisor really truly understand how to better support the CHW, but that supervisor is also a bridge between the CHW and their work, as well as the rest of the team, and helps educate the system or the team that works with or that's impacted by the work of the CHW. Continue, please. All right. Supervising CHWs. A common challenge in CHW programs is figuring out who should supervise them. Often supervisors come from clinical or administrative roles and may not fully understand the CHW work. But effective supervision requires more than oversight. It takes a real understanding of the CHW scope, how they build trust, and how they work in the community. So some of the common conflicts are who supervises the CHW. Continue. Continue, please. Whoops. You can go back one, please. Okay. Thank you. Reiterating some of the things that I mentioned. Thank you. Go forward to the next slide. So what holds it together? Supervision is one piece of building the sustainable CHW program, but there are more to consider. This section of the toolkit also includes guidance on funding and reimbursement strategies, as well as training, leadership, and professional development. Together, these elements ensure that CHWs aren't just hired, they're supported, they're retained, and given room to grow. Thank you. Okay. Next slide. So some pausing and consideration. Before we move on, take a moment to reflect on this question. What investments, financial, relational, and cultural, are we willing to make to keep CHW work thriving within your organization? Feel free to jot it down, journal it, or just sit with it for a moment. Okay. Moving to the next slide, and I switch over to Sylvia.
Thank you, Maria. Loving those pauses that really make us sit with those questions and in awareness. So loving it. And we will move on to planning to practice making integration real. Like this is the real nitty work that we'll be getting into now. And in this section, we'll focus on putting the integration into practice and like the tangible things that will work for us and how CHWs are brought into teams. And we'll turn it over to Lily to share more.
No more side roads. CHWs at the table. Yay, we finally made it. Once CHWs have been hired, organizations should ensure that CHWs are fully integrated into the culture and practice of your teams, and that the culture and team structure also meet the needs of the CHWs. Next slide, please. Where the work meets the workflow. Effective onboarding practices. Build CHW confidence and connection from day one through intentional onboarding and orientation structures. Communication, EHR, access and documentation. Ensure CHWs have the tools, access, and support needed to communicate documents and collaborative effectiveness. Integration doesn't end at the team level. It needs to show up in systems, structures, and communication. A question to carry forward. Where can we start integrating CHWs more intentionally into existing workflow and teams? So let's think about that for a second. As we come to our final section, let's take a moment to think of this question. Feel free to write it down or just hold on to it as we move into our final section. Next slide, please.
Thank you, Lily. So welcome to our final section, not waiting to evaluate. Start with the end in mind always. Evaluation and continuous improvement. When designing CHW programs, it's important to plan for evaluation from the very beginning, not just after the fact. Starting with the end in mind helps ensure that your program stays aligned with your goals and your values, and that you can actually measure the difference CHWs are making along the way. Sylvia?
Thank you, Maria. And we will look at tracking the work scene, the change. And we know evaluation might not be the most favorable for everybody because it's time consuming as well, but it's really important. This is what this section is really about, to really show the understanding and the impact that evaluation can have on a CHW program. And here is a really good way to look at it with these 3 layers of eval. When you track, you look at the process, how are we doing? And it looks at how the program is being carried out, activities, consistency, and alignment with the intended goals, right? So you will look at your goals and how that process is going. Then you have your outputs. It's the what. Think of the what are we doing, and that measures the visible work being done, and such as services delivered, for example, home visiting that your CHW might be doing as an integration tool there or service in the healthcare setting. And also then the third layer is the outcomes. What changed as a result? What has changed because of your process, your outputs? What has changed? And that captures the effort of the program and improvements in health, well-being, and cost savings and satisfaction. For example, also a return on investment report or something like that might be one of your outcomes here. And when all three are tracked, you can adjust as needed and celebrate progress at times too. That sometimes we forget about celebrating, those baby steps that were a goal and that you were able to achieve, and clearly shows the value of CHWs that bring into the team and also that the communities that they are serving when they are being integrated. So this is a really good way to look at it, and a three-layer evaluation process form. And then we'll go on to the next slide. And so learning with the work, not just about it, is really, really critical. The feedback loops is builds intentional pathways for CHWs and community to shape, programs and policies in real time. And this is really important because the CHWs are the ones that are really in the front line of how the program is functioning, and how the tangible tools and things like that they're also being able to share with the community members is there. And of course, adapting to change and scaling up if something is not working or if there's room for improvement. Of course, there's tools and guides to help programs respond, grow, and stay grounded in CHW values while scaling. And evaluation, again, is really, really powerful tool because it is practical, ongoing, and inclusive. And also then, from what I've learned, I was one of the first CHWs integrated here in California in, out of all places, NICU, so neonatal intensive care unit. And we're able to then also do accompaniment and also home visitation services. And we were able to capture a lot of this information through evaluation, and then be able to share it to finance teams and things like that really the value of CHWs goes above and beyond of just being able to serve. It really saves money. It creates an impact, and going back to the population health, it then also improves population health as well. And again, just making those continuous improvements in the toolkit is also going to highlight strategies in creating feedback loops for your programs as well. And next slide, please. So we want to leave you all with real tools, as we have been mentioning, to take back to your teams and be able to enhance if you already, again, are doing a CHW integration program in your communities, in your hospital, in your healthcare settings. And this is gonna be a question again also, are we measuring what matters, or just what's easy to track, right? Is really going to be the question to meditate a bit on. And next slide.
Tools you can use, resources for real world integration. We want to leave you with real tools you can take back to your team. Thing went off. Okay, visual slide of resources. Here you will see several key resources. CHW's suite of CHW program development toolkits, the sustainability toolkit developed by eVision, and information on technical assistance services available through both CHW and eVision. And coming in August 2025, we'll be releasing a new resource titled Better Teams, Understanding and Integrating CHWs in Healthcare Settings, a toolkit designed to further support integration efforts in practical ground ways. Next slide, please.
This is my slide, I believe. Just a reminder for all of us to check out Envision. It is a free online platform with dedicated community members, CHWs, allies, supporters, and just again sharing a lot of their knowledge and lived experiences, and also sometimes how they've been integrating also CHW into their settings is really incredible tool and platform to be engaged in. So if you have not, you're able to download the app and be able to again engage in my Envision platform that way. Next slide.
Thank you, Sylvia. So before we wrap up and before we move on to questions and answers for this topic that we have discussed today, we want you to think about one more question because it's important to think about what your very next step would be. And so the question is, what are you taking with you today that you can implement tomorrow? And as you think about this question, think that it could be a small shift. Maybe it's a new conversation or a tool you're ready to try. Whatever it is, that next step, it starts with you and what you've learned today or what you're taking with